All right, so we have hit the 7 o'clock mark, so we're going to go ahead and get started. Good evening and welcome to the webinar. This evening, I am excited to bring you the first session in the Immune Deficiency Foundation's Living Well with PI series. This series will focus on lifestyle management topics geared towards the PI community and will include an education session followed by some time for Q&A with our presenter. Tonight's featured topic is integrative medicine and pain management, led by Dr. Maeve O'Connor. My name is Emma Mertens, and I'm the Program Manager of Education at the Immune Deficiency Foundation. On behalf of IDF, we thank you for joining us for this virtual event. Through this series, we will explore topics that can complement your treatment regimen to improve outcomes, reduce symptoms, and enhance overall quality of life. We hope that through your participation in these programs, that we may move forward in our vision of a healthier day, every day, for every person living with immune deficiency. Here are a few items to keep in mind for the webinar. This evening, we are using the Zoom webinar feature, and attendees should be able to see the slides and hear the presenter and host speak. If you wish to enable closed captioning, click Show Captions on your Zoom toolbar. You can view the full transcript by clicking on Show Captions and navigating to View Full Transcript, and from there, the transcript will appear in real time on the right side of your screen. Attendees will not be able to activate their video camera or their microphone, which means all your questions will need to be typed in the Q&A box in the control panel of your screen, and they will be read aloud on your behalf. Please refer to the ground rules for Q&A, which will be pinned at the top of the chat box. A recording of tonight's webinar will also be published on our YouTube channel. We appreciate your patience as it will take about 2 weeks for that upload to be completed. And we will be adding the YouTube channel link in our chat as well. A brief disclaimer. Please remember that information presented during this meeting is not intended to be a substitute for medical advice, diagnosis, or treatment. We are here today as a trusted source and friend to provide you with information. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. Never disregard professional medical advice or delay seeking it based on information presented during an educational event. This webinar is made possible by our wonderful sponsors. It is due to their partnership and contributions that we can provide programs like this for the PI community. Please join me in thanking our sponsors. And now I am so pleased to introduce our presenter for this evening. Dr. Maeve O'Connor is a distinguished allergist and immunologist and the founder of Allergy, Asthma, and Immunology Relief in Charlotte, North Carolina. Dr. O'Connor has dedicated her career to diagnosing and treating complex allergic and immunologic disorders, specializing in asthma, food allergies, eczema, and immunodeficiencies. Her practice takes a patient-focused approach to care, combining cutting-edge treatments with personalized management plans to optimize quality of life. Welcome, Dr. O'Connor.
Thank you, Emma. I'm going to try to share my screen now. Okay, can you see that okay, Emma?
Yep, looks great.
Wonderful. Well, thank you very much. I'm very excited to be here tonight. Thank you for the invitation and for allowing me to present on this really important topic. And as I was preparing this lecture, I realized there's a lot on this topic. And so I tried to pick the highlights I thought would be most interesting this evening. And certainly there's a lot that will not be covered tonight. So I just wanted to let you know that there may be more information than is available in this talk. I'm trying to advance. Hold one moment. Here we go. Okay, so tonight I'm excited to talk about an integrative health approach to pain management for those patients with PI so that all patients can live well with PI. So our learning objectives tonight are we're going to describe PI very briefly and pain, understanding the concepts that define integrative medicine, We're going to define an integrative approach to provide optimal PI care and pain, and we're going to look at traditional, complementary, and spiritual aspects of this. Going to try to briefly touch on the mind-body concept while opening the integrative medicine toolbox and understanding alternative and complementary therapeutic options. So everyone on this webinar knows what PI is, so I did not include that in tonight's lecture. But one thing I think is important, as Emma pointed out, is that our goal as immunologists is for all of our PI patients to live as normal a life as possible, a healthy life, and a happy life. And so I tell my patients when they first get the diagnosis that there are modifications to life that obviously need to happen, but huge major life changes may not always be necessary. And we just have to take it one day at a time. Most people with PI are able to live full and relatively normal lives, but adopting a healthy lifestyle is the key to this. So when we think about primary immunodeficiency and pain, we know that in PI, the immune system doesn't work properly, and this can make patients and people with PI more likely to develop painful conditions. PI patients have chronic conditions. This is obvious. These chronic conditions can lead to both acute and chronic pain. So a little bit about how pain works, especially chronic pain. So there's activation of neurogenic inflammation through innate immunity. This plays a key role in initiating and maintaining neuropathic pain. There are some features of bacteria and viruses that resemble those of our nerve cells. The dysregulated immune system that is a part of PI may not be able to distinguish between an infectious feature and a feature of the nerve cell, and this leads to neuropathic pain, which is one of the chronic pain disorders that many PI patients can suffer from. So again, we know in PI, the immune system doesn't work properly, which can make people more likely to develop painful conditions. So diving in a little bit more specifically, when we think about PI and pain, what kind of situations can cause this pain? We know that immune deficient patients are more prone to autoimmune disease. For example, in common variable immune deficiency, polyarthritis is fairly common. And this leads to painful and swollen joints in the knees, ankles, elbows, wrists, poly meaning many, arthritis meaning inflammation of the joints. So this can occur in any joint of the body. Acutely, infections can cause pain. Pink eye, I've had pink eye. It hurts like the dickens, right? Sinus infections can create pain and pressure in the face. Thrush from either inhaled steroids or antibiotics or oral steroids. Very painful mouths and gums can ensue from that. The common cold, upper respiratory infections can also cause pain, headaches, feeling achy and weak. Gum disease and cavities are more common in PI patients, and these can be extremely painful as well. Herpes simplex or varicella zoster, the pain associated with this is not unique to PI patients, very painful in anyone who's unfortunate enough to get this. There are also those PI patients that may get recurrent deep skin or organ abscesses that can also create pain. A little bit more diving into specifics of PI and pain. So GI disorders. We know that PI patients are more susceptible to certain GI disorders, celiac disease, inflammatory bowel disease, such as ulcerative colitis and Crohn's disease, pernicious anemia. All of these can cause uncontrolled gut inflammation due to a disrupted microbiome, and this can lead to chronic and acute abdominal pain. Malignancies are more common in PI patients, and patients can experience pain from the cancer itself or from the treatment that's used to treat the cancer. Chronic inflammation typically can manifest painfully with an enlarged spleen or enlarged lymph nodes or swollen glands, as those are often referred to the layperson. So we see all the ways that PI patients can have pain, both acutely and chronically. So what can we do about it? Well, tonight I was charged with integrative therapies and integrative modalities to help PI patients with pain. I am also fellowship trained in integrative medicine. And so I would like to kind of give you the difference between integrative medicine and Western or traditional medicine so that we're all speaking the same language on this webinar. So Western or traditional medicine is a system in which healthcare professionals treat symptoms and diseases using drugs, radiation, or surgery. And when I say healthcare professional, that can mean doctors, nurses, pharmacists, or any type of therapists. But that is actually the definition of what we engage in when we are part of the traditional medicine model. This is also called allopathic medicine, biomedicine, conventional medicine, mainstream medicine, or orthodox medicine. So these terms can be used interchangeably. And it's different from integrative medicine in that integrative medicine uses the tenets of traditional medicine, but really puts the partnership between patient and practitioner at the forefront. That the patient and practitioner, again, whichever type of practitioner it is, that they are partners in the healing process. Integrative medicine is also inclusive of all influences on a person's individual health. As I mentioned with Western medicine, it's treating symptoms and diseases using drugs, radiation, or surgery. With integrative medicine, those can be used as well, but it's taken into consideration each individual's physical influences, emotional, social, mental, spiritual, as well as environmental. So really encompassing everything that can influence an individual patient's health. And that also helps increase that partnership that I mentioned between patient and practitioner that is at the forefront of the practice of integrative medicine. Shared decision-making is part of that partnership, where all options are presented to the patient, keeping all of those individual influences in mind so that patients can be part of the decision-making process, not just simply getting a prescription for a medication or a test is just ordered without a discussion, and having the patient and their caregivers input so that the decision is made jointly. Also paramount to integrative medicine is health promotion and the prevention of illness and pain whenever possible, not just reacting to someone who has symptoms or already has a disease, but also preventing illness and pain whenever possible. So the therapeutic goal of integrative medicine is treating the entire patient. We think of patients not as their disease, but as a person with a disease. Integrative medicine, oftentimes people think, oh, that's the fringy, or that's medicine that really isn't accepted. And oh, am I going to be a guinea pig if somebody wants to employ integrative medicine techniques for my healthcare? And all of that couldn't be further from the truth. Integrative medicine neither rejects conventional medicine nor accepts alternative therapies uncritically. So with integrative medicine, the use of all available evidence-based therapy is considered, whether it's Western or traditional, alternative or complementary, or integrative. But all integrative medicine practitioners use evidence-based therapy only. Again, not using alternative therapies uncritically. We all know that good medicine is based in good science. A lot of the science is now catching up as more integrative medicine concepts are being researched in placebo-controlled trials and things such as that. We haven't had as many of those as we've had in the traditional medicine research literature. And this approach to care is really recorded from the earliest medical history. Hippocrates himself said, "It is far more important to know what person the disease has than what disease the person has." And I often will tell my patients, yes, you have primary immune deficiency, but that does not define you. You are Susan with primary immune deficiency. You are Jack with primary immune deficiency. You are not primary immune deficiency, and that is all. And that seems so simple, but it's not as simple, especially when you're dealing with busy healthcare practitioners. And I'm sure some of your heads are nodding as I say that, right? So this is a very nice picture of what I've been describing. This is, again, integrative medicine, living well with PI and pain, but to kind of let us all see this in a picture format. Western medicine, complementary medicine, spirituality, nutrition, exercise, support system, stress management, and again, spirituality being at the top. Not touting particular religions, but what is a person's spirituality and how does that affect their health or the decisions they may make about their health? Is their nutrition being assessed? How do they manage stress? All of these things in combination to let patients living with PI have the best and most productive and happy lives. So, what is in the integrative medicine toolbox? One thing is hydration, but many things. But again, I'm pointing out some of the big ones here. Acupuncture, breathing techniques, mindfulness, nutrition, I mentioned that already, supplements, again, undernutrition, but sometimes standing alone, exercise, massage therapy, and I'm sure a lot of people are on the webinar saying massage therapy. Where do I sign up for that? There's lots of places to get it. Yoga, both hot and regular yoga, and then biofeedback as well. So all of these are part of the integrative medicine toolbox that we use. We don't use all of them in every patient, and we don't use maybe any of them in one patient. It all depends, again, on that individual patient and all of those individual aspects and triggers and influences that are part of that individual patient's life. So a little bit about acupuncture. So I think there's a lot of misconceptions about acupuncture. But traditional Chinese medicine, there's been over 2,500 years of acupuncture use, and it's well documented in the literature. And the National Institute of Health recognizes acupuncture as an effective adjunctive therapy for multiple indications. So that's quite an endorsement from the NIH. The benefits of acupuncture can be difficult to measure in controlled research and clinical trials, however, but there are many reports of decreased chronic pain, which is important to this conversation we're having this evening, improved relaxation, as well as increased energy. Acupuncture is actually pretty low risk. A lot of patients are nervous about acupuncture, thinking that it's a high-risk procedure, but it's actually pretty low risk. There can be some pain, a little bit of soreness, and maybe some bruising. And infection is a big concern, obviously, in the PI community, but single-use disposable needles really mitigate the risk of infection. And any certified acupuncturist is going to be using single-use disposable needles. So how does acupuncture work? So acupuncture, there's multiple points in all areas of the body, trigger points or pain points, again, depending on the patient. And appropriate points may be far removed from the area of pain. So a patient may come in with pain in the upper abdomen, and a needle may be inserted in the foot because of how the body talks to itself and how one part of the body talks to another part of the body. The needles are inserted to different depths at strategic points throughout the body. The needles are very thin, almost hair diameter, very thin. So insertion usually causes very little discomfort if patients even feel it at all. I have actually had acupuncture and I never felt it at all. Once the needles are inserted in all of the different points, then the needles may be manipulated in a variety of ways. So the acupuncturist may gently move or twirl the needles after placement. They may apply heat, or they may even use mild electrical pulses on the needles to increase the transmission of energy across those needles in hopes of, again, alleviating the pain. When the needles have been in place for about 10 to 15 minutes while the patient lies still and relaxes, then the needles are removed, and there's usually zero discomfort when the needles are removed. Some patients even report feeling relief even from their pain upon needle removal. So I mentioned that it's sort of difficult to quantify benefits of acupuncture. There was a systemic review that was published in 2012, so a little bit older, but it was done to identify randomized trials of acupuncture for chronic pain in individual patients. And what it showed was that the effects of acupuncture were persistent over time, and the benefits could not be explained away by the placebo or sham effect. So what they did was there were some patients who had fake acupuncture, and they had patients who had real acupuncture. But the effects of true acupuncture were persistent over time, and it was concluded that acupuncture is effective for a number of chronic pain conditions. So shifting gears, I wanted to talk a little bit about the fight or flight response and the relaxation response. We know that the fight or flight response is our natural stress response. It's designed to help us deal with dangerous situations, whether it's a lion or a tiger coming at us in the woods, or whether it's getting a diagnosis of PI and having to navigate what that means for yourself and for your families. The fight or flight response suppresses the immune system. It can cause high blood pressure, depression, anxiety, and a host of other ill effects on the body. Those suffering from chronic disease feel this even more. We know that the sympathetic nervous system controls the stress response, and the parasympathetic nervous system controls the rest and relaxation response. If you activate one, you suppress the other, and they should really be in a balance like two children on a seesaw. But again, when someone's really stressed, then the fight or flight is going to go up, and that suppresses the immune system and can cause all kinds of issues. Mindful breathing, as we probably most of us know this, but we're going to delve into it a little bit more detail. Mindful breathing is effective at causing the relaxation response. It interrupts the stress response with a profound sense of rest. So you're going to say to me, I'm on this webinar with what Emma said was a distinguished immunologist, and she's going to teach us about breathing. Yes, I am. It's cheap. It's free, actually, and it's very few side effects, and it works. So I was fortunate enough to study under Dr. Andrew Weil when I did my integrative medicine fellowship, and he taught us the 4-7-8 breathing technique. I use it very often when I'm feeling stressed throughout a normal day. When I have a particularly stressful event, I may use it more often. But Dr. Weil describes this as the natural tranquilizer for the nervous system, and I have to agree with him. 4-7-8 breathing takes the shallow, oxygen-poor breathing you normally do when you're stressed out, and it turns it upside down. How does stress cause problems? Well, when you have stress, you're going to underbreathe, that shallow breathing, guppy breathing, you may have heard it called. This can lead to actually mild hypoxia or low oxygen in the blood, depriving not only the blood, but the tissues in the brain of oxygen, causing a buildup of excess carbon dioxide in the tissues, which leads to oxidative stress, inflammation, and acidification. And this sets everything up for more disease and more pain. So 4-7-8 breathing is very simple. The name kind of gives it away. You breathe in through your nose for a count of 4 with your mouth closed. Then you hold for a count of 7. I can't do it and talk at the same time, but I hope that you guys are trying to practice this. And then you release your breath from your mouth with a whooshing sound for a count of 8. Without a break, breathe in again for a count of 4, repeating this entire technique 3 to 4 times in a row, then resume normal breathing and activity. So I'm often asked by patients when I review this with them, why do you make the whooshing sound? I like the whooshing sound because I think that when you're releasing the breath from your mouth during that count of 8, you're getting rid of the stress. You're getting rid of the toxins. You're getting rid of the negativity. You're getting rid of that oxidation. So I like to hear it come out because for me, it's sort of symbolic that I'm getting rid of the stress. So breathing in for a count of 4, holding it for a count of 7, and then releasing loudly with a count of 8, and repeating this 3 to 4 times in a row, and then resuming normal breathing and activity. It's safe and effective. But we do suggest only doing it for 4 cycles in a row in the beginning, and then working up to 8 cycles. I've had very few patients report feeling lightheaded at first, but if they do, this passes. Again, I employ this pretty much every day in my normal day-to-day life, and I tell patients about it very often. Again, it's free, very low side effects, and it works. There's another type of breathing that's very similar, but it has a couple of little differences to it, called active cycle breathing technique, ACBT. This is patient-directed again, easy to incorporate into your daily practice. Everyone can do it, and it's safe. And there's 4 basic steps. Breathing control. So you start with just relaxed breathing, then 3 to 5 deep breaths or thoracic expansion exercises, and then that forced expiration or forced exhalation, like that. And some patients will then cough either involuntarily, but it's also suggested to cough voluntarily after the forced expiration technique. Why do we suggest ACBT in conjunction with or instead of 4-7-8 breathing? Because it helps clear the airway of secretions, improving lung function, reducing the risk of infection, and improving the overall effectiveness of cough. So as we know, PI patients often can have pulmonary infections. So ACBT may be something to incorporate during certain times, whereas 4-7-8 may be more anytime it would be appropriate. So health benefits of breathing well, kind of in summary of a literature review that I did. So there was a study of senior citizens done that showed reduced anxiety after 2 months of employing daily deep breathing exercises. Breathing well has also been shown to lower blood pressure. Slow, deep breathing for 5 minutes has been shown to reduce blood pressure and heart rate. This is good for cardiovascular reasons, also for inflammation, all of which, again, inflammation leading to pain. Improve sleep. When someone breathes well, practicing deep, slow breathing techniques, this triggers that relaxation response. And if you have a relaxed aura, then you're going to be able to sleep, fall asleep, and also have improved sleep hygiene throughout the night. A study of 16 healthy people found that those who practiced relaxed deep breathing experienced less pain than those who practiced deep breathing that required a lot of sustained attention. Both groups, however, experienced less tension, anger, and depression. So again, if you're wondering why we're talking about breathing, right there, one study, there are many studies about breathing well and pain. That was just one that I found and thought I would share with you. There was a 2017 study that examined the effect of 8 weeks of deep, slow abdominal breathing on attention, emotions, and stress levels. After training, the people in the deep breathing group performed better on tests of attention and had fewer negative emotions than those who did not participate or were trained in the deep breathing exercises. Okay, so shifting gears, a little bit about mindfulness-based stress reduction. Mindfulness training, what is that? Mindfulness training is when we teach ourselves either on our own or under the guidance of someone else who is well-schooled in mindfulness training to develop non-reactive awareness of our surroundings. So it helps us to distinguish experience, my thoughts and my feelings, from sensations such as shortness of breath. So I'm having a stressful situation and I'm nervous about it, would be my experience, but I'm having this shortness of breath and my heart is racing. Those are the sensations. By being able to distinguish those and focus on the difference through meditation and using controlled breathing, that can decrease the inflammation that one has in their body in reaction to stressful events, including chronic pain. Another part of mindfulness training is stretching all parts of the body to develop awareness during movement. We go through life and we're not even aware of what we're doing, how we're breathing. We've just discussed that, but also how we're moving. As we hurry through our days, we'll often bump our arms, bump our legs. And if you have PI, some of you may be more prone to bruising, or a scratch can lead to an increased risk of infection. So we want to not only slow down, but use mindfulness training to distinguish our experience, our sensations, to be able to meditate, and to be able to really focus on our movements physically as well as through our physical breathing. There's a wide body of research that suggests that a high level of mindfulness decreases anxiety and depression as well as chronic pain. And as I've said, and I'll say it again and again, the chronic pain, anxiety, depression cycle just can be very non-ending. And these are some very high benefit, low side effect modalities that you can employ to try to break that cycle. Nutrition is very important when we think about PI patients, inflammation, and pain. We know that poor nutrition can lead to many illnesses, from obesity to infection to so many different things. But infection, of course, being very important for the patient with PI who's already at risk due to that dysregulated immune system. And infections, as we pointed out earlier in this presentation, can lead to acute as well as chronic pain. So good nutrition basics I'm going to review with you now, and then we're going to get into a little bit more detail. Increasing the variety of foods that you eat while trying to maintain an ideal body weight. Ideal body weight. A lot of times when I say that to patients, they shut down because they think I'm just going to tell them that they're fat and they need to lose weight. That is not true. Everyone's ideal body weight, there's a standard, sure, we know about BMI, but individual patients have different ideal body weights when you take into account all of those influences I mentioned earlier: environment, spirituality, culture, all of those things. So ideal body weight may be different amongst different individuals. Making sure that you have adequate starch and fiber in the diet while limiting the intake of fat, cholesterol, sugar, salt, and alcohol. Organic food is always best, but this is not always possible because we know that organic food can be more expensive. Although I would argue that if you can find a good farmer's market, you may be able to get great organic fruits and vegetables even cheaper than you can get non-organic fruits and vegetables at the grocery store. One thing I wanted to comment on was the use of herbal supplements. So herbal supplements use is very common. I suggest them in my patients, but I suggest ones that are evidence-based with clinical research studies to back up the suggestion, and also based on my clinical experience, having used them in many patients over the years I've been practicing integrative medicine and Western/traditional medicine. Supplements are not considered drugs, and they are not regulated by the FDA nearly as tightly, if at all, such as our common traditional medications, such as immunoglobulin replacement therapy, for example, or antibiotics. There's a lot of scientific evidence that does show that herbal supplements can be immune boosting, but caution should be used. Supplements can be harmful, and some of them can interact adversely with medications. Your healthcare provider's opinion should always be sought. And there are some vitamins, electrolyte supplements, or probiotics that may be appropriate, and they may be appropriate even for you to decide on your own over the counter. But again, always think critically and be sure that there's evidence to back it up. But know that even if your healthcare provider, even if I suggested it to somebody, supplements are never a substitute for a healthy, balanced diet. A healthy, balanced diet is the best thing to decrease inflammation throughout the body. So diet plays an important environmental role in positively or negatively affecting both the gut microbiota and the immune system. So an anti-inflammatory diet helps manage inflammation and, again, may boost the immune system. So this is going to include fruits, vegetables, whole grains, unsaturated fats, while limiting red meat, dairy, processed foods, and alcohol, as I mentioned. We know that oxidative stress is unavoidable. Antioxidant foods and supplements do support the functioning of the immune system and, again, may boost the immune system in certain situations. There's a lot of evidence that show that saturated fats elicit an inflammatory cascade. We do not want that. So when we think about an anti-inflammatory diet, there are some simple things that you can do under the direction of your healthcare provider, making sure about your own health, your chronic health concerns, the medications and supplements you're already taking. But I just point these out as ones that are commonly used as part of the anti-inflammatory diet due to their anti-inflammatory benefits. So fish oil in capsule or liquid form, 2 to 3 grams a day for adults, containing both EPA and DHA. You want to find molecularly distilled products that are certified to be free of heavy metals and contaminants. And if a patient is vegetarian or vegan, they do have plant-based EPA and DHA available, and many of these are certified products. Ginger and turmeric, tons and tons of evidence showing the anti-inflammatory benefits of ginger and turmeric or turmeric, depending on what part of the country you're from. I say to supplement as tolerated. Some people can't tolerate the doses that are on the bottles because they can give a little bit of tummy upset to some patients. CoQ10, another known anti-inflammatory, 60 to 100 milligrams of a soft gel are easy to tolerate. I always tell my patients to drink plenty of water, pure water, or drinks that are mostly water. This right here is water. Tea or very dilute fruit juice, sparkling water with lemon. But when we're thinking about the PI patient, using bottled water or using water with a home water purifier to avoid any potential infectious or other contaminants. Again, anti-inflammatory diet important because inflammation promotes all kinds of bad things in the body, particularly in PI patients, including pain, acute and chronic. So some more general considerations with the anti-inflammatory diet, having a colorful plate. So if you look down on a plate with French fries and a burger, you know, it's kind of all beige. You want to have it filled with green and red, berries and spinach, and using fresh food, as I mentioned, whenever possible, avoiding fast food, hormones, antibiotics, and GMOs, and eating an abundance of fruits and vegetables as tolerated. Delving into a little bit about some of the specific antioxidants, flavonoids are pretty well studied. These support hydration and decrease inflammation of the airway surfaces, thereby decreasing the risk of infection and inflammation. Also been shown to prevent skin inflammation. And on the right-hand side of this slide, you can see how they work for the prevention and treatment of different types of dermatologic inflammatory conditions such as psoriasis, atopic dermatitis. They have a direct antioxidant effect that leads to protein oxidation and lipid oxidation. They also have an indirect antioxidant effect with their antioxidant enzymes. And you can see all of that there. So these are certainly, there's a lot of science behind the anti-inflammatory properties of flavonoids in some of the diseases that are high in inflammation, leading to chronic pain. Vitamin C decreases inflammation by impeding prostaglandin E2. Carotene has been shown to improve lung function. Selenium aids in preventing lipid peroxidation, which, as we pointed out earlier, lipid peroxidation being highly inflammatory. So we've talked about the anti-inflammatory diet. There's also the Mediterranean diet, and then there's the Western diet, right? So we always know that when people talk about the American diet, we see pictures of obese people that look unhealthy. And then you look at some European patients or people who live in the Mediterranean area, and they're thin and they're fit, but they're eating really well. Well, this is a nice contrast or comparison of the Mediterranean and Western diet. So you can see in the Western diet, desserts, sweets, processed meats, red meats, and highly processed foods are at the top, dairy being in the middle, whole grains, vegetables, legumes, and fruits being at the bottom. And as you can see with the Mediterranean diet, it's a very different picture. Having processed meats and red meats and sweets and potatoes at the top in the very small little triangle, whereas widening and more prevalent in the diet are legumes, nuts, seeds, olives, and the most prevalent being fruits, vegetables, olive oil, and whole grains. So just even having this in your mind when you're deciding what to put into your body can be helpful, because the Mediterranean diet has certainly been shown to be more beneficial for our health, more anti-inflammatory than the Western diet. The Western diet, however, is convenient, right? And it's cheap. You can go through a fast food drive-through and get a pretty large meal for $5, $6, maybe $7 or $8 now post-pandemic. And it's easy, right? You don't have to cook, you don't have to mess up your kitchen, but it's highly unhealthy. Frozen meals, processed foods, microwave meals, pizza. Again, we talked about highly processed things being pro-inflammatory, cookies and ice cream, fish sticks, chicken nuggets. Again, these convenience foods that have made life easier, particularly in our busy families, can also be pretty deleterious to our health, as they are pro-inflammatory and only add to the pain that can be seen in patients with PI. So in the Mediterranean diet, again, thinking about those triangles, right? The fresh foods from farm to table, eggs and seasonal vegetables, whole grains, including barley, steel-cut oats, nuts such as almonds, fruits, apples, and avocados, very well known to be highly anti-inflammatory. I mean, they don't say an apple a day keeps the doctor away for no reason, right? Right. And then some meats are allowed, like cold water fish and tuna, limited chicken. And, once I became much more healthy, actually, at the beginning of the pandemic, I started incorporating these things into my diet. So I'm not sitting here saying that this is always easy, but I can tell you that since I've been doing it, not only do I feel like I look better, but I feel better. I am much healthier, and I have had fewer infections myself. I'm very fortunate that I don't have PI, but certainly it has been beneficial, and I can attest to that. So when I say that the Western diet is convenient, but it's pro-inflammatory, well, how do I know that, or what do we know about this? The Western diet impairs the epithelial immune responses, promoting dysbiosis, dys, of course, meaning dysfunction, and inflammation. And you can see in this nice picture that I borrowed from Gut and the references there, the Western diet has emulsifiers, food colorants, carbohydrates, leading to dysbiosis, defective cells, which then causes E. coli to be able to get in through the leaky gut, polyunsaturated fatty acids, increasing inflammatory danger response through all these interleukins that creates acute gut inflammation along with the leaky gut. And then cholesterol, we all know that's pro-inflammatory and causes all problems for cardiovascular health. But even here in the gut, we can see the disadvantage of having a dominant Western diet as part of your nutrition plan. So these are the non-popular in some patients recommendations that I make, but certainly if we want to decrease the inflammation, decrease the risk for worsening of our chronic diseases, decrease the risk of infection, and turning on the autoimmune cascade in our PI patients that lead to pain, avoiding alcohol. The liver needs to be preserved, and I mentioned how important sleep is. Alcohol causes fragmented sleep. Avoiding tobacco. There's already enough respiratory issues in PI. There's already an increased risk of malignancy. Tobacco, there's no form of tobacco that is safe, and no, vaping is not safer. Avoiding recreational drugs unless prescribed. We know that recreational drugs can impair clear thinking, impair consciousness, and they can be pro-inflammatory. So the inhaled marijuana is 10 times more inflammatory than a cigarette, and is also increases malignancy risk even more as well. So I've said that it's so easy to do all these nutrition changes and just run out to your farmer's market, right? Well, if you're going to need help, like I said, I've done it and it wasn't easy. Patients say, "Oh, Dr. O'Connor, I don't think I can do this." It starts with one change at a time. You may, if your insurance covers it or you're able to pay for it, seeking a nutritionist can help because they can be part of that partnership for your overall health to help you get a good nutrition plan. Again, Farmers Market, I mentioned, there's healthy recipes online. And, I suggest to some of my patients, hobbies are very good for stress relief. What about if you combine a new hobby with your new nutrition plan and started cooking or started gardening or hosting healthy dinner parties and picnics? All of these things go hand in hand to help increase your general good health, decreasing inflammation. So, how do you educate yourself for improved health and less pain when you have PI? So I think it's really important to address those comorbid psychological issues that can occur with PI. We mentioned, right? Stress, anxiety, depression. I've got PI. What now? Now I've been living with it for a while. My medications are expensive. The prior authorization didn't go through. I don't know if I'm going to get COVID. There's so many things. There are so many support groups available, and exercising regularly can help as well. But taking an active leadership role in your healthcare. Ask for patient-directed healthcare objectives through educating yourself, asking your healthcare provider to give you educational resources. Know that you have limitations. Not all of us can do everything that everyone else can do. Know your limitations, accept them, and do what you can to do all the things that I've mentioned here. Always tell your healthcare provider the truth about your health. If you're doing some of the things that I said in this webinar not to do, there's no shame in it. But if you tell your healthcare provider, they can help you change it. And they can understand maybe why you're getting an infection. Maybe it's not that your medication is wrong. Maybe it's because you've been smoking behind the scenes or something like that. Very important and easy to say, difficult to do. Creating time for relaxation and rest. Remember, I talked about the fight or flight and the relaxation response, pro-inflammatory, anti-inflammatory. It's not all, taking supplements or exercise or mind body or even 4-7-8 breathing. You got to just develop some healthy habits and take time for yourself. Take time to decompress. Take time for healthy sleep habits. Take time to just take a walk. Take time for relaxation and rest. Very, very important. Physical activity is encouraged for all people. We know that there's a lot of research about the healthy mind and body and how exercise promotes both of these. It's an excellent stress and anxiety reducer. It can also help with weight loss. It can also help with keeping the joints healthy, cardiovascular health, as well as it can be fun. Like I mentioned, that you can run with a friend, start a biking group, jump rope, hula hoop. It doesn't matter. Just get moving. And remember, when you're moving, try to use that mindfulness to be aware of it. Develop your endurance and strength over time and know your limitations. Again, I mentioned maybe exercising with a friend. This can be really important for children with PI. Coping with a chronic illness, coping with pain as a child. Kids just want to be kids, right? So organized sports can be an excellent outlet and can also help directly and indirectly with chronic pain. Remember, there are some exercises that may be contraindicated for people with specific immunodeficiencies, no contact sports with Wiskott allergies, CGD, not swimming in the ocean or fresh water. And you will discuss all of that with your healthcare provider, depending on your specific diagnosis, your specific life, and all the influences that are individual to you. A little bit about sleep and a little bit of a deeper dive. Erratic sleep patterns, like I mentioned earlier, whether it's due to stress, whether it's due to having a glass of beer at night, can have negative effects on the immune system. It's recommended to go to sleep and wake up at roughly the same time each day. Now, I'm going to admit this is a hard one for me, so nobody's perfect. No late nights. and then think, I'll catch up on the weekend. There's no makeup sleep. Once you've lost it, you can't get it back. So try to go to sleep and wake up at roughly the same time each day. Minimizing caffeine or alcohol in the evening, I say 3 to 4 hours prior to sleep. Some patients need longer. Some patients can have it right before sleep and they do a sleep study and their sleep is perfect. Again, it depends on the individual. Don't eat late at night, heavy meals or late night snacking. Again, 3 to 4 hours. And we are all addicted to our electronics. We all have our phone right here. We're looking at a screen right now. We know that looking at a screen decreases our natural production of melatonin, which then leads to poor sleep. Erratic sleep patterns have what? Negative effect on the immune system. PI already has a dysregulated immune system, leading to all of the inflammatory conditions we've discussed and leading to the pain that we are trying to alleviate. Don't nap. Just try to sleep on your regular schedule. If you need a nap, take it, of course, but don't take long naps that may interfere with your regular sleep schedule. I'm running over a little bit on time. I only have a couple more slides. But stress and pain in PI, I think I've certainly stressed it throughout, but just to bring it home one more time, stress leads to sickness. Chronic illness leads to stress. That's another vicious cycle, right? We know that all of this negatively affects the normal functioning immune system. So, of course, in an abnormal or dysfunctional immune system, this repetitive negative cycle is going to have an exponentially worse effect. Reducing stress can improve immune function. Lots of research. I didn't bring all the studies. I just wanted to introduce you all to the ideas this evening. Physical activity. For some, that may be running a marathon. For some, it may be going to the mailbox. Proper sleep, massage, and psychological therapy. I think all patients with chronic disease should have therapy. It is good for your mind. It's good for your soul. It's good for your anti-inflammatory lifestyle. Biofeedback, meditation, hobbies, social interactions with others. And once you have a handle on your PI diagnosis and you're feeling like you kind of got it, volunteering, maybe helping others who have a new diagnosis, maybe helping through the IDF for one of their walks, maybe going to a homeless shelter and just helping someone who's not related to PI at all. All of these things are good for the mind-body connection and decreasing inflammation. There's a lot of useful resources. This is just one partial list, but I always say ask for help, whether it's you helping yourself by using resources such as going online, looking at the IDF, the American College of Allergy, Asthma, and Immunology, the American Academy of Allergy, Asthma, and Immunology, local support groups, regional support groups, your primary care physician. I'm going to come back to that. Your immunologist, all of your healthcare providers on that team, whether it's your physical therapist or your immunologist, your family, your friends, coworkers, your PCP. I have that highlighted for lots of reasons because a lot of PCPs may not be as familiar with PI as your immunologist. But by asking them for help and talking with them, you may help educate them so that they can be better partners, not only for you, but for other patients with PI. So that's why I have that highlighted to remind me to tell you that. Future topics, because we did not have a time and I'm already over my time. We may talk a little bit more about biofeedback, more detail on meditation, yoga, a lot more on sleep hygiene and exercise plans, supplements, medical THC, massage, yoga, and pain management referrals, right? I made it sound easy tonight to say, oh, acute pain, chronic pain, do all these things and you're going to feel a lot better, even though you've got all that pain from your PI. But not all patients can have relief from their pain by doing all of these things. Some may need a pain management referral to a physical medicine and rehabilitation physician. And that's something that could be a future topic. In conclusion, the integrative health approach to pain management in PI is multifaceted and does require a partnership between the patient, the PI, the person with PI, the individual with PI, Susan or Jack who has PI, their families, their partners, their caregivers, and the healthcare team. There are many clinical trials. Many of them are small, but there are promising results and outcomes. We need more controlled trials with integrative medicine and primary immunodeficiency. Integrative medicine therapeutics do improve outcomes when used in conjunction with conventional treatments and sometimes when used on their own. Harmless approaches should be incorporated. Again, breathing, whether you do the 478, whether you do the ACBT, whether you just do deep diaphragmatic breathing, meditation, harmless, good nutrition, harmless. Always want to make sure that integrative medicine approaches are based on objective and statistically significant data, but integrative medicine approaches can improve pain in PI. I want to thank you for your attention. Again, thank you for the invitation. I'm honored to have been here tonight to present, and I'll just leave you with this wonderful quote. A happy heart is good medicine, and a cheerful mind works healing, but a broken spirit dries up the bones. Thank you very much.
Wonderful. Thank you so much, Dr. O'Connor. That was awesome. All right, everybody, we are going to go ahead and we are going to get into some Q&A as time permits, as long as Dr. O'Connor has a little bit of time for us this evening. And thank you so much again. On that note, I want to start Q&A with a nice comment that we got. This individual said, Dr. O'Connor, this was incredible. I tried the 478 during the presentation and I did feel noticeably lighter, so thank you. So love
Yay!
that. Love hearing our participants using our education content in real time. So that's awesome. All right, so this first question comes in about acupuncture. So this individual wants to know, what type of pain does acupuncture work the best for? Is it a certain painful area of the body, like the back or the neck, or is it maybe better for certain diagnoses, CVID versus XLA, that type of thing?
So I don't think it matters which type of PI that you have. There's a lot more research on acupuncture with acute injuries, such as tennis elbow or back pain, things like that. But there is a growing body of evidence with chronic pain, even with inflammatory bowel disease, even with inflammation from autoimmune disease. So I don't think that there's any harm in trying acupuncture if your healthcare provider agrees for any type of pain. Because the worst thing that will happen is that it won't work. But I have had lots of success suggesting this for my patients. And as I mentioned, I've tried it myself with success.
Thank you.
You're
All right,
welcome.
next question. This person wrote in, I have never been able to use anything from the health food store as they are not regulated, and I worry that I could get sick from some of their products. Can you tell us if this is true, and how would our community be able to judge if something is safe or not from one of these stores?
Well, this is why I said I think very strongly. Anyone who knows me knows that I have a strong personality, that you want to use caution. You don't want to just walk into a store and grab a supplement because you read something in a magazine that said this supplement is going to work for my, pain from my, lupus, for example. You want to have a discussion with your healthcare provider and look at the evidence from clinical research. You can do a PubMed search. You can look online, make sure that there's a clinically based trial, placebo-controlled trial, for example. I never suggest that someone, especially with chronic illness, especially with PI, just run in and try something that is not regulated. There are some supplement companies that have the seal of approval. So there are some certified products. I still say that you would like to have that discussion with your healthcare provider, making sure. There have been reports of supplements that have been unregulated, and when you test what was inside the capsules, it was sawdust. There was nothing in them at all. We hear these horror stories, but we also know that there are very wonderful, reputable companies who do the testing within their company, who have published papers on supplements, who only use natural ingredients, and those are where we find the benefit. There are numerous companies. I do not endorse any, so I don't want to name any specifically, but with your healthcare provider and your own advocacy and leadership in your healthcare journey, you can find these. Just don't get overwhelmed. Does that help, Emma?
I think so. Thank you.
Good.
All right, our next question. This individual wants to know, are there acupuncture providers or nutritionists, and I'll add in any other providers in this integrative medicine space that may know more about PI than others? And how would I go about finding someone who is aware of my illness and can factor that into the care that they're providing?
So again, there are, certified registered dietitians slash nutritionists. There are certified trained acupuncturists, traditional Chinese medicine trained acupuncturists. I do not know of many who are well versed in PI. But what I have done in my community is I have gone and educated them about PI, and I encourage my PI patients to have the conversation. If they find somebody who's got all the certifications, who has perhaps a good reputation, to say, okay, Emma, my acupuncturist that I'm interested in working with, how do you feel about having a conversation with Dr. O'Connor? Because I'm open to having that conversation because, as I mentioned, partners in care for my PI patient. And so we only can expand the knowledge of PI by continuing to educate all people. We know that the delayed diagnosis to PI can be anywhere from 9 to 15 to 20 years, right? The reason why that's getting shorter is because we're doing things like webinars. We're doing things with the IDF like walks. We go out and educate. More research is being done. So this isn't where I'm going to give a little call to action and say, use your voice, ask questions and say, are you willing to learn? Registered dietitian? Yes? Great. Then I think I could work with you. A lot of times there's fear. I don't know about that. I'm not sure I can work with you. But if someone's willing to learn and willing to partner, then I say go for it because they will be able to help you. You'll have the backup of your healthcare team, and you may help that specialist help other patients. It's a team effort, right? Not only in the healthcare for your healthcare for PI, but in the global effort to make PI more at the forefront of all people's minds, right?
And that's exactly our mission. So I love that. Thank you.
Exactly.
Thank you for adding that in. That's great.
And
All
it's my
right.
mission too, you know?
Yes, yes. Love that. All right, next question. This individual is a vegan and wants to know if krill oil is okay as an alternative to fish oil. And because they're vegan, they're actually wondering, is there a vegan source of omega-3 that will meet their needs?
Yeah, so krill oil would be safe, but there are seaweed-based EPA, DHA supplements on the market. Again, I'm not going to promote a certain brand, but there are seaweed-based ones, and I often will suggest those not only for my vegan patients, but also for some patients who can't tolerate the fish oil. So I'm also an allergist, so there's some worries about fish oil and fish allergy. Also, some patients get that burping with the fish oil. And so I will suggest they freeze it and then take it frozen because that can decrease the burping. But if even that doesn't occur, I recommend the seaweed-based omegas. So vegan, that's a good idea. And then if there's any intolerance, it's also a good idea.
Wonderful. Thank you.
You're welcome.
All right. This next individual wants to know, do you have any feedback regarding the American dietitian diet or the sort of style of My Plate, where I think we've all seen it, the plate, and it's got certain segments of this much
Mhm.
vegetables and this many meats. Um, she wants to know, or they want to know, your feedback on that, and then also how PI patients who might have other things going on, like you mentioned, allergies or celiac disease, or maybe they're vegan, like the last individual, how can they adjust the Mediterranean diet to comply with their other dietary needs?
Yeah, so I think that the diet of plates is a good concept because it gets people thinking about the colorful plate and the amounts of each type of food that should be consumed. I am not a big fad person, but I do know that fads and catchy names get people's attention. And if that helps people have an anti-inflammatory approach to their nutrition, I'm all for it. Paleo, keto, I'm much more an anti-inflammatory diet, Mediterranean diet, limiting the Western diet type of provider. It's easy, it's proven, and it's clean. With celiac and food allergies, I have obviously a lot of patients with these issues. This is where that partnership again is important, and using, your voice, saying, I really am struggling because I'm allergic to these foods, but I need more protein. And so, I do a lot of it because I am integrative medicine trained as well. Not every allergist immunologist is. So giving them some grace too, and asking them, say, is there a food allergy registered dietitian that you know that specializes this? There's many more of these around the country than there were 10, 15 years ago. Gastroenterologists, some of them have excellent registered dietitians who are schooled in celiac and inflammatory bowel disease. I am fortunate that I did the Integrative Medicine Fellowship, and I feel very well equipped to do it. But not everyone has had the time to do that. There's only a handful of us out there. There's only a handful of people who truly specialize in rare disease, which PI still is, and then these rare individual kind of concerns. And so that's where your voice is important. Your caregivers' voices are important. If you're tired, frustrated, I just don't care anymore, get your mom, get your spouse, get your partner, get your friend to say, I don't know, Dr. O'Connor, we're worried about food allergies. So we need to talk about that today. Use your voice, be an advocate, be your own advocate. Again, your health is yours and you are in charge, but you've got a whole team that wants to partner with you, especially by incorporating Western and integrative medicine, right? The combo.
Wonderful. Thank you.
You're
All right.
welcome.
Just as you suspected, we have had a couple of folks interested in learning more about massage therapy, and we had
Mhm.
someone ask, do you have any recommendations for getting insurance to possibly cover massage therapy?
So, have I ever done it? Have I ever gotten it approved? Well, yes, I have. But do not get excited because it's rare. It's very, very difficult. Um, Quantifying chronic pain can be difficult. Insurance companies want a scale that they can prove that it's definitely a cause and effect. I think we know from the difficulty with prior authorizations for required and necessary immunoglobulin when you don't have it, so it's an uphill battle. Some massage therapists may work with you on payment because of chronic illness. There are some out there who will do, I wouldn't say pro bono, but they may reduce based on the disease. I have gotten it approved, but it has been very rare. But that's a great project for someone out there to start advocating for so that we can get integrative medicine techniques insurance covered by insurance. I'd be on board with someone helping with that project. So many of these things aren't covered, right? But they should be. And in Europe, a lot of these are massage, acupuncture, nutrition. Oh my gosh, in Europe, so many of these things are covered. In a lot of ways, they're ahead of us, and a lot of ways we're ahead too. It's not a competition, but wow, wouldn't it be great if they were covered? Especially when you think about all the things we just talked about, the decrease in inflammation, the improved stress, the improved infection rate, the improved pain. Unfortunately, we just got to keep fighting the good fight.
We sure do. Thank you. All right. This individual wants to know, do you have any recommendations on what may work best for peripheral neuropathy as far as pain management techniques?
So, peripheral neuropathy is a very difficult one. And I showed the one slide that kind of shows how that occurs in the body, right? So I definitely think with neuropathic pain, peripheral neuropathy, there are many different chronic illnesses that can be the cause of that. Diabetes, of course, being one of the most common. So making sure that you understand perhaps why you have it, to see if there's anything in the body that needs to be maximized maximum control. For example, diabetes. I'm just using that as one example. I think that with peripheral neuropathy, a neurologist's input is very helpful. I think that's where the team approach can be very helpful. I know there's some physical therapy things that work, and then there are prescription medications that usually are helpful for that. And I do not recommend, opioids and pain medications that can become addictive, because chronic pain is chronic, right? And so addiction will ensue nearly 100% of the time. So that's a time to have a conversation with your immunologist. Say, is there somebody that you could refer me to? Exercise still does help. Nutrition helps. Everything we talked about tonight will help. But when you truly have a diagnosis of peripheral neuropathy, you may need to combine Western a little more than just integrative.
Thank you. And I just wanted to share, we've had a bunch of very appreciative comments from folks saying that they hadn't always had the opportunity to access this type of information, or maybe their primary care had kind of discounted these methods of, pain management, integrative medicine, saying that there's they weren't going to do anything for their symptoms associated with their PI. So I think folks are just really grateful for this information, and knowing that there are other strategies that they can, integrate into what they're already doing to really optimize their health and help with their quality of life. So we're really appreciative, and I think our audience is too.
And I'd like to say something to that, because I first of all thank you, and I appreciate it. It is one of my passions, and I want to say that we've got to give grace to people who are in the front lines taking care of patients, right? So as we partner, you also are partners with your healthcare provider, right? And we doctors and therapists and physical therapists and nutritionists, we're all people too, and not everybody knows everything. And so sometimes you can help educate. But again, that partnership is a two-way street. And I tell all of my patients that help me help you, right? And so I like to put that out there, not just because I'm going to side with all the healthcare providers, but because we're all in this together, right? So I just wanted to put that out there to everybody, to be a team. That's how we've gotten diagnosis to be a shorter amount of time. That's how we've gotten so many immunoglobulin replacement options. That's how we've gotten some insurance companies to be a little bit easier to deal with, right? So we just keep forging forward, Emma.
I love that. Thank you. All right, we have just a couple more. Um, so we know that you mentioned this in one of your slides, and we didn't have time to cover some of the topics on that slide, but would you briefly mind sharing your perspective on the use of CBD or medical THC?
There are states where this is legal. There medical marijuana, medical THC, with a prescription. There is a plethora of evidence about chronic pain, and THC in different formulations. There's a plethora of research about stress reduction, restful sleep. I am not going to leave this webinar with everyone saying that I am promoting that everyone go out and get this, okay? I mention it because I want to be inclusive of everything. And so if your healthcare provider suggests it and it is legal and you have a prescription and there's a way you can take it without it being pro-inflammatory, such as inhaling it, which is not good, then I'm all for it. When I started doing integrative medicine, I got a little bit of pushback from friends and colleagues. And my answer was, if running down the street backwards while wearing bells helps someone's knee pain, then I suggest they run down the street backwards wearing bells because it's harmless, kind of like the breathing. And if there was evidence to show that that worked, it would be even better. So I refer to the literature on THC and CBD, and I say that there's a plethora of it, and I think a lot more is coming.
Thank you. Great answer. All right, and last question/comment. We do have a bunch of fans of your talk and I think of your style in the comment section, and folks would like to know if you offer telemedicine at your practice.
I do offer telemedicine at my practice. Yes.
Wonderful. I think we'll have a lot of happy campers to hear that, so thank you.
You're very welcome. And again, I'm just honored that I was invited. Thank you for the invitation to the IDF. And I just encourage everyone to utilize the resources of the IDF and volunteer if you're up for it.
Thank you so much. What a great plug to end our to end our talk on. Thank you so much, Dr. O'Connor. And thank you everyone in our audience for these thoughtful questions. We really appreciate you taking the time to type those in the chat and for us to have a fun conversation after the talk. So thank you so much. And Dr. O'Connor, I know you probably want to get back to your evening, so you are free to go. We really appreciate your time. For our audience, we just have a couple of quick slides we want to share here at the end on some upcoming resources and events. Thank you so much, Dr. O'Connor.
Thank you. Thank
Have
you,
a great
everyone.
night.
Have a
Thank
good
you.
night.
Thank you so much. All right. So for the rest of us folks still on the webinar, be sure to check out our website for additional resources, upcoming events, and more. All IDF materials are free to access, print, or mail directly to you. And if your question was not addressed during the program, you can contact our resource navigator through our Ask IDF program. She will personally connect with you to tackle your question and direct you to appropriate resources. And you can even take IDF on the road with our engaging podcast series. You can find programs like Bold Conversations and Undiagnosed by searching for the IDF podcast. Are you looking for ways to connect with others who are also navigating life with a PI? You might be interested in joining one of our many Get Connected groups. These groups are free, virtual, volunteer-led opportunities to connect with others with PI all over the US. We offer location-based groups or nationwide groups, and because these groups are virtual, you are not stuck with whatever state or area or diagnosis you're in. You can join any group, anytime, any leader that works for you. IDF's new documentary, Compromised: Life Without Immunity, offers an intimate look into the world of those living with primary immunodeficiencies. Screenings and private watch parties are available now by requesting the film at primaryimmune.org/compromised. And the Walk for PI continues this fall with several more in-person events and even a virtual way to participate. Visit the Walk for PI website, which we are going to link in the chat, to register and build your team. We offer webinars each month, in case you didn't know, and we hope to see you at one of our upcoming programs. Here's a look at what we have coming up this fall. And on that note, if you have a great idea for a topic or a presenter for a future event, we definitely want to hear from you. Visit the link in the chat to submit your idea for consideration. And before we close, we want to thank our incredible sponsors for supporting our education initiatives here at the Immune Deficiency Foundation. We could not execute these programs without their support, and we're so grateful. We appreciate your participation this evening, and I want to give a huge thank you again to Dr. O'Connor. We hope to see you at our next webinar, which will be on September 19th, and I hope everyone takes care and has a great rest of their evening. Thank you so much.